For 2 minutes.
Thank you very much, Mr. Speaker. Let me start by saying thank you to Vice Chairman Bilirakis and our Chairman, Dr. Rowe, and also to the Ranking Member, Sergeant Major Walls from Minnesota. It's been great to work with them. They've been very helpful with this bill. I'm honored to speak in support of my legislation, H.R. 2601, the Veterans Increased Choice for Transplanted Organs, or VICTOR Act. America owes our veterans every advantage when it comes to receiving an organ or bone marrow transplant. Yet the current VA transplant policy often runs counter to the medical interest of the patient. There are only 14 facilities in the nation where a veteran may receive a transplant in the VA healthcare system, and none of these facilities performs all types of transplants. Timely organ transplants often represent the difference between life and death. Unfortunately, due to government bureaucracy, are often forced to travel hundreds or thousands of miles repeatedly in order to get the chance to receive a new liver, heart, or kidney. That travel alone can prove fatal. Traveling to get a transplant isn't the only obstacle these patients face. Oftentimes, it is the program itself. The limited size and scope of the VA transplant program means veterans have a lower chance of getting a transplant and a greater chance of dying while on the waiting list. The VICTOR Act allows veterans who need an organ or bone marrow transplant through the VA system the ability to access a federally certified transplant center close to their home if the veteran and the doctor agree that that is medically safer. It will make it easier for veterans to access life-saving medical care by allowing them a number of ways to qualify for care closer to home. As a surgeon and as a veteran, I believe this is good medicine and good public policy. The status quo puts roadblocks in front of veterans who need life-saving transplant care, and the VICTOR Act eliminates these roadblocks and increases access to care our veterans have earned. Thank you very much, Mr. Speaker, and I yield back.